It's again my great pleasure to host the second Global Oncothons this session and to have our distinguished speakers. I will introduce all of them. They are representing different countries with different challenges, and let's touch on all and discuss all the challenges that they are facing in pediatric oncology care. So it's my great pleasure to introduce Professor Mahmoud Hammad, who is a professor of pediatric hematology and oncology at the National Cancer Institute at Cairo University, and he is the director of Nasser Institute Oncology and Nuclear Medicine Center. Dr. Lorna Renner, who is the past president of SIOP Africa Continental Branch, Laila Hessissen, who is the president of French African Group of Pediatric Oncology and past president of Moroccan Society of Pediatric Oncology and Hematology, and Dr. Sultan Stambekov, who is the head of the Pediatric Oncology Department of the National Center of Maternal and Child Welfare in Kyrgyzstan. So let's start with ladies. Ladies first. So Dr. Hessissen, could you start sharing your perspective on the challenges in pediatric oncology that you faced during your career and currently, and how you envision the future for pediatric oncology?
Thank you very much. I'm really delighted to be connected with you today. I initiated pediatric oncology in 2000. It was in a really small center in Rabat with only like 8 beds. And I have seen the development of pediatric oncology through the 25 years. And I have seen in Francophone Africa the creation of a new pediatric oncology centers. We were at the beginning with 6 centers, so now we are 24 centers, but this is not only in Francophone Africa. All around the world, we have seen the development of pediatric oncology, and with the creation of the global initiative of childhood cancer. There is this worldwide initiative, but I have seen also my colleagues struggling on the ground to set up this pediatric oncology activity, because this is was not an easy choice for them, because there is other specialties where the psychological impact and burden on the personal life and the professional life is less than in pediatric oncology. So this was not an easy choice for them. But I have seen also very resilient people working hard, even with few possibilities. And so those teams need to be supported. So how can we support them? My opinion is that we have to act on 2 levels. They need to be supported at the country level, like a kind of bomb that's got to be put on the pediatric oncology, and so they can develop the specialty. They need the training, they need good facilities, they need the multidisciplinary team, they need support from their government, and they need funds. They need to be funded for those activities. They need a clear strategy for this, and this is the idea of the pilot site of WHO. And add to this, there is a need of much extended support at the international levels to advocate for them, to support them, and put health coverage, international health coverage, support the drugs, access to drugs, adapted treatment regimen, information system training. So I believe that the strategy put right now is in the good way to improve pediatric oncology in low middle income setting, because there is a lot of stakeholders working at the country level and supporting the teams, and other stakeholders like WHO, SIOP, and Root, working at the international and both we can achieve good survival rate for the children, but the main challenge for those countries remains the difficult context in the country level, and so the political, geopolitical problems. So, but I believe that all together we can achieve a good future for pediatric oncology worldwide.
Yeah, absolutely agree. Today, when we started the Oncothon, I think there was no speaker that everyone mentioned about the collaboration. Everyone mentioned about the network. Everyone mentioned that we need to work together to. And yesterday, one of our colleagues mentioned that if we want to go fast, we need to go alone. But if we want to run, we need to go with the team. So thank you very much for sharing your experience. In the meantime, let's continue with Dr. Stambekov, who will introduce their experience in Kyrgyzstan. And yeah, let's go from there.
Hi, everybody. First of all, I want to say thanks to the organizing committee.
Yes, okay, thank you very much.
That invited me to such a very good oncothon, and it's a very good idea. And by this idea, the main thing in pediatric oncology, the awareness will grow many times. I mentioned about the awareness due to my story. Before 2014, in my country, there were only one department within 20 beds, and the government financed to all children only $12,000. And per year, we had only 70 new cases of cancer. But in 2014, one person whose child was suffering from cancer told about the situation in internet, in Facebook, and everyone saw it. So our Ministry of Health and our president decided to change situation. And previously I was an adult oncologist, and they called me and other specialists to organize the pediatric oncology in our country. Since 2014, many things changed. We had a lot of dreams that came true now, and we can say that it's all happened due to our team. Team must be very good team that includes not only the doctors, but it should include the professionals from healthcare foundations, all volunteers, all persons who wants to change the situation. Since that, now we have we have increased the financing for the pediatric oncology 200 times, and it become more than $2.5 million, which our government give us to buy chemotherapeutical drugs. And also foundations build us a new big hospital for pediatric oncology, 2 departments. And last year we started autologous bone marrow transplantation, and it all happened during only 10 years. If 10 years ago there were only one specialist, now we have 12 doctors. We have special team for palliative care. We have special team for surgery and special team for radiation therapy. So everything can be changed by team. I'm saying it as a person who tried many times. So awareness can help you very much. I can explain you. For example, I tried to incorporate our country in many initiatives, and many times we were rejected. And even in that cases when they rejected all us, the people from our government, people, rich people, and or colleagues from other countries saw that we have a strong desire to improve everything and helped us in another way to reach all standards that are using in all developed countries. So even in low income country, you can change the situation in the right way if you collect a team and if you organize a good plan. Thank you very much.
That was wonderful and very insightful. It's always very interesting to hear all the country-specific initiatives, problems, and also solutions. Thank you for that. And let's try to connect also Dr. Mahmoud, who were having some technical issues. But I think, Dr. Mahmoud, can you hear us?
First of all, it's thanks for OncoDaily as well as for the initiative with Gevorg, which is doing tremendous work and effort to support childhood cancer as well as to support SIOP, as he's right now the president of SIOP Asia. He's doing great effort in this branch. And for the second year in a row, I'm happy to chair with different providers concerned with childhood cancer. And I started to consider February 15th as a very important day on my calendar as an International Childhood Cancer Day that joins a global effort to raise awareness, support children with cancers as well as their families, and promote interaction between different stakeholders in the field. First, I would like to show the critical concern of childhood cancer in Egypt due to the large number of cases, the demand for specialized cancer services, and limited resources. And in some branches, there is less favorable survival rates. And we have the goal, as well as with WHO Global Initiative, to reduce the disparity in survival rates between low-middle income countries as well as developed nations. My main concern, I will discuss a problem related to national transplant program, as well as the second point, I will show the effort of SIOP Africa to spread knowledge among different African countries in all disciplines, including oncology, clinical pharmacy, and research, being the head of SIOP Africa Training and Educational Committee with the help of SIOP African Board. You all know the burden of childhood cancer in Africa in general. It constitutes around more than 25% of the global childhood cancer cases, which is a very big number, and also adding to this the difficulties and limited resources in dealing with such patients. And we have in East Mediterranean region more an incidence that around 30,000 cases per year, with high mortality in East Mediterraneans reaching around 13,000. And we all know that fatality rates depend on capacity of different national health systems for early diagnosis, treatment, and availability of all treatment modalities. So if we compare the developed countries and high-income countries, we can see that around 80% of children with cancer will survive, compared only to 20% of childhood cancer survivors in low and middle income countries. For Egypt, there is a high incidence of new cases and cancer patients in general, not only for pediatric patients, reaching around more than 5,000 cases per year, which is a very high number of cases. And one of the healthcare hurdles that we have is a steady increase in population, because we are a big country with a population more than 105 million citizens. And there is increase in cost of treatment, as you all know, and devaluation of currencies, and the continuous increase in the percentage of cancer patients, as well as we have the problem of consanguinity, which increase some diseases, including thalassemia syndrome, that's considered a significant public health problem in Egypt. Also, the centralization related to some specialized medical services, including the stem cell transplant, which is now taking a very national and important direction to improve stem cell transplantation across all Egypt. First, I would like to show who is providing services in Egypt. Is the Ministry of Health, the university hospitals, some military hospitals, and non-governmental organizations and private sectors to a lesser extent. We are now having in the Ministry of Health around 10 specialized pediatric oncology centers, which is a very good number and increased over last years. Besides this, for transplant, we are working on distributing this service across different governments in Egypt. We have now around 17 transplant centers across Egypt, and the transplant program has started early on in around 1989. And you are having now a bed around more than 120 beds, and average transplanted cases per year for adult and pediatric cases around 900 cases per year. We provide all transplant categories, including autologous transplant, matched sibling transplant, umbilical cord transplantation, as well as haploidentical transplant. We are trying also to collaborate with some neighboring African countries, as well as East Mediterranean countries, including Libya, including Kenya, to try to provide the specs and the technology needed for them to raise and spread this service in their countries, and to start giving them the outline for the specifications for bone marrow transplant rooms and its needs, and HEPA filtration systems, and other important processes that is needed for transplantation, including training for apheresis, to separate stem cells, as well as the importance to provide laminar flow and the way to cryopreserve and others. For us, I would like just to give an outline for one of the biggest transplant centers in Egypt, which is which is Nasser Institute Transplant Unit, that includes around 20 beds, as well as Dar es Salaam Cancer Center that includes right now 19 beds, and we are increasing more and more beds every year. The challenges include a major cost drivers for stem cell program, which is always the drugs, as well as the labs and radiology. including HLA typing and some molecular techniques to diagnose, which needs actually to raise donations to help these patients to properly diagnose, as well as to help them during the journey of their treatment. And another important point that's actually a minus in many African countries is the availability of donors, because we don't have or possess local donor registry. And only in South Africa have a bone marrow registry that gives them an access to a very big number of donors worldwide. This obstacle is actually in Egypt have been mitigated with the use of haploidentical transplant, which is provided only in 6 centers in Egypt. Another economic challenge is the price of transplant, as well as the supportive care for such patients. But still, more than 90% of patients are covered by health insurance and funded by states and funded by the state. And we are working on national effort to increase the bone marrow transplant packages to include all uncovered expenses. Also, it's important to know that we have started an African initiative, which is the African Blood and Marrow Transplant Society, that started in 2018 with a meeting that was held in Morocco. Moving to the second point of my discussion today is the initiative to improve the educational activities in African continent. And we have actually started a program with collaboration with SIOP Africa, as well as BioVenture Health through African Access Initiative. And we provided, they supported us with the platform, they supported us with some speakers to partner to give an overview on pediatric cancers and increase the awareness of this disease and these malignancies across different African countries. Besides, we have started in South African program, which is an educational program that presents different that will cover all topics related to pediatric oncology, as well as it will move to transplant at an advanced stage. And we have designed a 4-module program that will cover basics of oncology, different hematological malignancies, solid malignancies, neuro-oncology, and other disciplines related to pediatric oncology, in a trial to collaborate and spread the knowledge. And thanks for giving me the opportunity to be a part of Oncothon this year for the second time. And I wish you a very successful event today.
Thank you so much, Dr. Hammad, for sharing your experience. As I would like to conclude this session, and I would like to thank our colleagues from different countries, from different settings. Some of the challenges are the same, some may differ, but our goal remains the same: to improve care for children with cancer. But today is not just about discussions, it's about action as well. As you know, Her Royal Highness Princess Dina challenged us to move beyond words and take real steps to make a difference. She challenged 3 friends to donate $10, and the 3 friends are required to challenge other 3 friends to donate $10. And in this way, we create the chain, and this way we can help childhood cancer research. So thank you very much for being with us today. I see Dr. Lorna here. We had a technical problem with her, but if she can hear us, let's hear also her perspective. Do you hear us?
It's very brief.
Wonderful.
Yes, I can hear you. Clearly. Good. I'll be very brief. Okay. So just as the WHO Director General said, we can stand together against a devastating disease that affects all of us. At WHO, we are committed to closing the cancer gap, particularly in women and children's cancers. So there are gross disparities in childhood cancer outcomes between low and middle-income countries and high-income countries, particularly incidence rates, the outcomes, the short and long-term effects. And we all know the reasons, some of them for this: socioeconomic reasons, geographical reasons, where you are, access, gender, race, tumor biology, and also access of clinical trials in low middle income countries and the general policy environment. Okay, so I'll just briefly go on to talk about what we've been doing in Ghana. We know the GICC initiative, WHO, so it's 60% survival for all children by 2030 and reduces suffering for all, with the hope of saving 1 million children's lives over 10 years. And one important objective is to increase the capacity of countries to provide quality services for children with cancer. And it's a multi-pronged way of going about things. And just to say what's happened in Ghana, so our program has been very involved, a lot of stakeholders involving the Ghana Health Service and fully involving the Ministry of Health. And we have a National Childhood Cancer Strategy document. We've got our Childhood Cancer Society of Ghana. We've got treatment guidelines, national treatment guidelines completed, and with advocacy from an important personality, the previous First Lady of Ghana, we had 4 childhood cancers included on the National Health Insurance Scheme, leukemia, Burkitt, Wilms, and rectoblastoma. And we continue ongoing training for health workers. And I'll just go on to just briefly state what our successes have been. Before 2019, that's before the global initiative, we had only 1 pediatric oncology unit. Now we have 3 and 5 shared care centers. We had only 3 pediatric oncologists. Now we have 10 pediatric oncologists within a space of 5 years. And we've trained 1 for Sierra Leone. And we've got now 29 pediatric oncology trained nurses and pediatric oncology trained pharmacists. So what are our good practices that we'd like to share? We've been supported hugely by World Child Cancer. We'd like to thank them so much, and the UBS Foundation. And importantly, it's important to have local ownership from the hospital to the national level, governmental and non-governmental stakeholder involvement right from the onset of these programs. And just to show that even in low middle income countries, we can achieve a lot, but we have to make sure that our strategies and our interventions are determined by local needs and priorities. And it's important to have a local steering committee oversight. Advocacy is very important. We need to assess the national situation and present, if possible, a cost effectiveness document so that the policymakers will be bought over and they would want to invest in childhood cancer services. We have to ensure that the reach goes from national to community levels, and we have to ensure that it's multidisciplinary, as we're doing here, quite holistic, with awareness creation, capacity building, human health workers, psychosocial capacity building, educational opportunities for the children whilst on treatment, technological advancement, health financing, which we've improved here. And it's important to have advocacy and good policies. And we should remember that we should involve the survivors. They're a loud voice. They've been through it, and they can also be good advocates. And we've used survivors. We're using them as patient navigators as well, very successfully. Strategic partnerships are very important. Nationally, using an important personality, for example, as has been said, First Ladies, and other important organizations and international partners, for example, World Child Cancer and St. Jude. So this just shows now we've also gone up from being able to diagnose only about 140 children a year in the whole country in 2016. Now we've been able to diagnose almost 500 children per year. So we've been able to improve access and outcomes with this multi-pronged approach for children with cancer. So I'd like to thank the organizers of this Oncothon, OncoDaily, and SIOP International for this opportunity. And I hope together, and we hope you'll all contribute to improving childhood cancer outcomes for children in all over the world, globally. Thank you very much.
Thank you so much, Dr. Renner, for sharing the experience. And it is always very encouraging to see next to the challenges, also the improvements and the things that we try to do even with the limited resources. So I would like to wrap up this session. Again, thank you all the speakers for your contribution. And let's enter into the next session. Thank you.